The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. This is Dory Nightingale from ICPSR. Thank you for joining today's webinar, Accessing Linked Health Data in a COVID World. What is the state of play? This webinar is hosted by IASSIST and ICPSR. And just a few housekeeping things before I transfer you over to our panelists. Well, so as the world has recently moved to virtual experiences, we want to note that the online meeting environments may have some technical issues. We'll be here to answer any technical questions during the webinar. If the webinar were to close unexpectedly, just reopen it from the link in your email. In the unlikely event you experience audio issues, please look for a pop-up window that may be behind your GoToWebinar screen. This webinar is being recorded, and the recording and slides will be available afterward. We welcome your questions, and actually this is going to be a little bit different, so you can type in your questions at any time. If you're joining in from a laptop or a desktop, use the questions box in the GoToWebinar control panel on the right side of your screen. If you're joining us via iPhone or other mobile app, look for the question mark icon on the bottom of your screen. If you're attending via a mobile device, you may have to swipe left or right to see the presentation. Okay, so this is where I usually reiterate how to answer questions, but during this webinar, you'll actually have the ability to raise your hand and interact with the panelists. So if you're in the audience, I want you to try to locate the hand where you can raise your hand, and the panelist at different points during the webinar will see your hand, and if we can see if you have the ability to speak, if you have a microphone near your name, they will unmute you so you can interact. Okay, and I believe that is the last housekeeping item. And so I will turn you over to I believe it's Amy Pienta who's going to be next from ICPSR.
Hi, thanks for that, Dory. I am your IASSIST guide and introduction to the webinar. My name is Amy Pienta. I am Director of Business and Collection Development at ICPSR. To introduce you to what I do at IASSIST, I am one of the elect members at large in the IASSIST Administrative Committee. And as part of that role, I am chairing the Professional Development Committee that serves IASSIST. That committee puts on this webinar series, and ICPSR is the gracious host of that webinar series, as Dory mentioned. Over the last couple of months, we have opened up our webinars outside of the IASSIST community to be by and from IASSIST members, but inviting the broader community to come and check out both our content and our organization. So to that end, I will just mention to you that IASSIST as an organization is about supporting the professionals who support either IT or data infrastructure that support research and training and education at all sorts of organizations. It is made up of professionals in libraries and academic settings, in data infrastructures, and in repositories. So if this is your introduction to IASSIST, please check us out on our website, iassistdata.org. And with that, I'm going to turn to introducing our speakers and discussion group today. So one of the features of IASSIST is that we offer interest groups where smaller groups and communities come together to discuss mutual shared interests. One of our newer interest groups is the Health Data Interest Group. And so the really great slate of panelists that we have today will talk a little bit about what that interest group is aiming to do and hopefully generate discussion with all of you. This is our first time using the webinar to have a discussion So bear with us as we follow your hand raises and discussion. If the hand raising isn't working, you can still chat things, and I will read to the group what you're trying to contribute and input. So with that, I will turn it over to the next part of your webinar guide. That is Richard Welpton from the Health Foundation. Go ahead, Richard.
That's great. Thank you so much, Amy, for the introduction there. So I'm Richard Welpton. I'm a senior data manager at the Health Foundation, which is a research health charity based in London in the UK. Our remit is to improve the health of the nation and to improve our health service. In previous roles, I've been a member of IASSIST for a little while now. But moving to the health research sector, in particular, made me realise the need for a group like IASSIST. There's a lot of interest in using combined health and social science data. There's a lot of health data infrastructure that's desperately needed. And so I was really pleased to put together the Health Data Interest Group just over a year ago, primarily aimed at IASSIST members who support researchers to source and apply to access health data and health data linked to social science data, but also aimed at professionals who are supporting the development of health data infrastructures. So I'm not sure what just happened there, but it seems that, apologies for that, the slides just seem to revert to my desktop. So I'm also joined today by Deborah Wiltshire from UK Data Archive, Sarah Young from Carnegie Mellon, Amy Solis from University of Southern California, and this has also been developed by Yanis Kotrotsios from Cancer Research UK, who has recently just come back from being furloughed because of the COVID situation that we have at the moment. And I think Amy's done a really good introduction about the role of IASSIST, and I've just introduced the Health Data Interest Group. So we hope to be doing, we hope to run more discussion groups like this and webinars in the near future. Of course, as Amy said, this is open to non-IASSIST members, but of course we'd encourage you to join IASSIST. It's a fantastic organisation. But in particular, if you're interested in keeping in touch with us, if you'd like to receive information about forthcoming events, then you can follow this this link to a survey where you can just join our mailing list. And I think that should go into the chat room for you to see as well. So I see Deborah has. Thank you. So I think what I'm going to do now is just turn to the discussion. And today's discussion is about accessing health data in a COVID world, and what's the state of play. So I think for many of us, applying to access health data can be quite a challenging process to go through for various reasons. Patient data in particular are sensitive data. And there's a lot of concerns about the ethics of using patient data, issues around trust, etc. And one of the things that we've noticed recently with the COVID-19 situation is that in some cases, some of the previous information governance barriers appear to have come down a little bit, and there have been faster ways of accessing health data to be able to do research into COVID-19. So it kind of sort of begged a few questions in our minds about how data and data sharing infrastructure has changed as a result of COVID-19, whether our roles as data professionals have changed during this period, And then thinking about how we can effectively support researchers with their data needs in the current environment. And that might be to support researchers who are interested in doing research around COVID-19 or associated research, so looking at some of the demographics around COVID-19 and its effects, or just doing any non-COVID research. And then we're also interested to think about whether, if changes have occurred, whether those changes are permanent. So, as I mentioned before, it seems that in the UK, the process for accessing health data has eased a little bit now because of this disease. What we're wondering is whether things will go back to the way they are after things have settled down, or whether we can expect to see permanent changes. And this is meant to be a discussion, so we want to invite as many of you as possible to take part. We're interested in hearing your views. It would be great if we can navigate around these 4 questions, and I think Sarah is going to kindly keep a record of all the points. So at the end of this discussion, we can clearly say what's changed and what we need to do further. And I think that would be a really useful outcome for this webinar. So I'll be honest and say I'm completely new to GoToWebinar. I can't see whether hands are being raised already, but what I would like to do is invite the floor, as it were, and hand this over to you all, and invite people to come and talk about their experiences, or if they have any specific questions they'd like to ask, just to kick us off. So Amy, am I handing back over to you?
I am watching, and so far we do have no hands. I guess I can start though with a question or a comment. So I've been very active in the Research Data Alliance, they have been producing guidelines for making sure that COVID-19 data have the best chance of being accessed widely and accessed quickly. And it's a set of guidelines and recommendations, if you're familiar with the Research Data Alliance, that basically they're in the stage of having produced the draft prior to the final release that is right now available for public comment. It spans domains. It's omics, it's clinical research, it's social sciences, epidemiology, and other cross-cutting groups that are producing those guidelines and recommendations that are meant for funders and for researchers and for archives who all want to work together to make sure data are accessible. I'm wondering if there's perhaps from the IASSIST work group interest in reviewing those guidelines and perhaps making comments during this public comment period, or how the work group might sort of be interested in the same kinds of things that could be mutually beneficial. I think I'm a member of this working group. If not, I just joined.
So I think that's really useful. Thanks, Amy. And I haven't read the report yet, but I have. It has come into my inbox, and we can circulate the link to that, because they are after feedback by June the 8th. But Amy, I don't know if you maybe be able to summarise. I don't know if there's sort of 2 or 3 recommendations from that report that particularly stood out to you, that you're able to share with the group here today, please.
Sure. At least I can certainly sort of give the high level points from the social science group, which I think overlaps really nicely with this interest group. I think that we were mainly concerned that across the domains, that social science data in combination with health data was really crucial for understanding the impact of the pandemic on populations, with the potential benefits of either ameliorating some of the negative outcomes or preventing them. And so I think people were concerned that that there was cross-domain research around the health data that are important right now, that include the social sciences. That some of the challenges that we're facing is making sure that we have the ability to link data across these domains. And so if the social sciences is particularly good at understanding the social context or the neighborhood context or the small geographic unit context, that those kinds of data are produced and stored in ways that can connect to those kinds of constructs that are important from the social sciences. And so I think that's like an interesting topic. Another is that because so much of the work that is ongoing right now in COVID-19 tends to be on sort of convenient and limited samples, that social sciences in particular have really good methods for adjusting for selection bias. And because of that, we want to make sure that the measures that allow for those kinds of selection bias corrections so that studies are more representative, that we have those measures and data available. And I guess the last thing I'll say, the sort of the third point is that because of the focus on human subjects research in what all of us talk about frequently in IASSIST, that we have something particularly valuable to say and offer on the subject of protecting vulnerable populations and indigenous populations and the health data that's being collected and used from those groups, to make sure that the data and the research are representative, but also protecting those populations and their interests. So maybe that will be some fodder for discussion.
We've just had a question. Are we able to supply the link to that report, Amy? Have you got that to hand?
Yep, I'm gonna pop it in the chat. Yep, when I'm done talking.
And there's another question from Jennifer Butcher. I'm sorry for mispronounced your last name. She said one of the issues in the US is that there are no standards for state health agencies, so they are recording apples and oranges. And I totally agree with you, Jennifer. The US has a lot of agencies and centers that are doing similar work and that record their data very differently. For example, we find a lot of the COVID data from the Center of Disease Control, the CDC here in the US, but there's a lot of agencies. The US Department of Health has a lot of agencies under it that also collect similar information, but not in the same way. So that is a big issue that we have in the US, especially for researchers that are trying to research COVID-19 at the moment. Yeah, it's fragmented, and that's something we definitely deal with in the US.
I think that's a really interesting point. It's a sort of concept of maybe what we call in the UK data standardization, and obviously, England is generally quite a small country, but we have quite in some respects quite a defragmented health and social care system. We've got a number of agencies that are involved with the collection and dissemination of health data. We have individual hospitals that are responsible for actually recording data before sending it through to a central agency, and yeah, there's quite a lot of variation in terms of how things are recorded. I think that's always been a problem, and actually I think you're sort of talking about demographics and the importance of looking at demographics. Ethnicity is one of the key bits of information that people need to use to do analysis with, and it's really quite amazing how poorly recorded, if it's recorded at all, it can be. And I wonder if this is an opportunity to say, we've been calling for some kind of harmonization, some kind of standardization for years, and there's a real reason why you know, we've been asking for this. Is this an opportunity for to try and get some standardization happening, and how do we go about doing that? So I don't know if that's prompted any further questions. I can't see actually if who has their hands up. So
we do have a question. Yeah. So there are governmental surveys such as Pulse that are scientifically sound, but much of what is coming out other than epidemiological studies are bypassing peer review. Since most of us work with university researchers, how would you recommend vetting studies?
Well, I don't know if one of my colleagues would like to answer. This came up. This was actually in the news in the UK this morning, and I wonder actually if it raises a more general question about whether some really important aspects of data curation, data management have fallen a bit by the wayside in response to the COVID situation. Whether there's been a little bit of a rush, understandably, to do things, and some really important aspects have kind of been put aside a little bit, and whether that's causing us problems now and whether that's going to cause us some problems in the future. I'd be interested if anybody has some experiences of that.
Todd Quinn said that was a Guardian News article yesterday on this topic.
Some follow-up comments. So who should create the standard if we're choosing how to vet studies? Who should create the standards, do we think? It should be the UN World Health Organization, which leads us to who will fund the WHO, or should we just wait until after the US elections and cross our fingers? I don't know whether anybody wants to expand on that question. That was raised by Todd. I don't know, Todd, whether you'd like to say any more about that. Or Jennifer.
Can I just, sorry, double check? When is it possible to let people speak, or is everybody generally muted?
I think it might be easier to unmute.
Yeah, I can unmute everyone. Let's see. All right. Oh, wait. All right, now everybody will be unmuted. Did it work?
Hi, this is Jennifer. I'm the one who asked about the WHO. And if we need to have a standard setting organization to set the standards for health data, and it does have to be the World Health Organization. I don't know why they had not done this before, or were they anticipating somebody else doing it? I'm on more the social science than the health sciences. Has there been health standards or harmonizations approached before? Or, I mean, because that's the biggest thing I see, is that we could start having data so that we can all look at this data and it all means the same thing. So has this been tried before? If not, why not? Why hasn't the WHO done it? So I'm wondering if anybody has seen any of that type of discussion.
Yeah, I think Richard, you might be muted now. Sorry.
Okay, yeah, I think that's a really important question, Jennifer. I think my experience, at least in the UK, is it's actually quite difficult to get some kind of harmonisation at the national level, which I think the first comment was about thinking about the situation in the States. So I'm not even sure if that can then be taken to an international level, but it is interesting. We do have international standards for the classification of diseases. So I don't know why that couldn't be extended beyond on that. You know, medical codes have ICD-10 codes, so that we can make these cross-country comparisons.
I notice that Allison Zhu has her hand up. Can you unmute yourself, Allison, and ask your question or contribute? It says you are self-muted, so try hitting the microphone in the control panel to unmute yourself. I'm gonna go on. I saw Bob Ray, you had your hand up for a minute. Can you, oh good, Bob Ray, you can talk. I see your green. Why don't you do that while we work on working with Allison?
Comment to Jennifer's, the World Health Organization, first of all, you'd have to look at their mission. And I think the vast majority of the studies that are out there would not coincide with their mission. So I think certainly, yes, as Richard mentioned, we have ICD, we need some very basic things such as what do we count? We've seen problems with some places conflating antibody tests with the other tests and so forth. So that part I think should be easy to do, even though I know we haven't done a good job. But that's a tiny, tiny piece of what's out there. As you mentioned, Amy, a lot of what we're interested in, it's the economic surveys, it's the social surveys, it's all those types of things. That's not something World Health would do, it has nothing to do with them. There's zillions of very specific studies, medical studies, scientific studies. And again, these are the types of things that generally there would be a peer review process. You would go through your thing. Yes, it's your publication really that's judged as opposed to your data, but in the process, the data does get looked at. And all that's gone by the wayside. So for all of us that are librarians, we're told, at least if we work in a research library, we're supposed to represent all points of view and collect things and this and other. Now, we don't label them as, oh, we think this is bad, even if we do. We're buying these different things. But with data, it's different, particularly health and things like that. So whether you're ICPSR or UKDA or GASIS or so forth, you're typically putting things in there that have gone through some type of review process. They have been viewed as scientifically sound. And maybe right now is not the time for us to deal with that, but at some point we're going to have junkyards of misinformation.
So I think that's a really interesting point, O'Brien. I think it kind of, I'm thinking about the question we have on the screen about the role of data professionals, and everybody in this meeting is a data professional in some kind of capacity. And with what you say about making, we could end up with a lot of junk. How do people see the role of data professionals in this time? Has our remit changed? Has our remit become much more important and much more crucial? What do people think?
I think it probably has in that sense. I think for organisations such as the UK Data Archive, for example, those involved in the curation of data sets, they do carry out quite rigorous quality assurance checks, and I think that's going to become even more important than it already is, because I think there's a role for us to be the gold standard, if you like, a place where people can trust that the data they'll access is going to be of a good standard. And I think that's true for all data services more than ever.
We have a hand raised by Simon Parker. I'm going to unmute you, Simon.
Who will be responsible for introducing standards is how we would engage with the commercial sector. And I think that's going to be particularly important in terms of medical data, because if we think of the data which is being generated by things like radiotherapy machines or anything like this, often these are done to proprietary formats because companies want to have their kind of infrastructure as the one that's used, and they work well with themselves, but they don't necessarily work well across systems. And I wondered how we would go about addressing that. It's easy for us as data professionals to be saying, yes, we should try and meet these standards, but actually, if the equipment isn't generating data which is easy to get to that standard, then who is the burden of work going to fall upon? Which I think might be a challenge.
I think that's really interesting, Simon. And I think what you've highlighted there is for kind of like there's like a sort of like a line of proprietary proprietorship from, like you say, particularly in the health system, for actually the people providing machines, equipment, medicines, and so forth, with the data that those generate in the process of providing treatment to patients, to that then being recorded, to the data then being sent to a central repository and then being tidied up and made into something useful for researchers to use. That's quite a. I think that's what you highlighted there. I think that's a really interesting point.
Paula Lackey has her hand up. I'm going to unmute you, Paula.
So I'm thinking about all the different roles in IASSIST, and you had asked what is the role that we might be able to play, and I do think that the potential is there for this to provide permanent change, because we have data scientists around the world who are totally excited about data and are not very attuned, or maybe just becoming attuned to the necessity of understanding metadata. And this might be where the social sciences has really been a fantastic leader for over 50 years. So it's our moment really to capture the attention of the data scientists globally. And I think we can raise awareness. If we can have our materials in all languages that we have, our materials available, and keep saying, hey, like going into anyone, I know a different Simon Parker Seamus who's becoming interested in his Tableau use of COVID data and his analyses that he's sharing. And he's not a social scientist, so he needs to learn about the metadata standards. And instead, he's talking about the problems that he's having as he's diving into his data to make sure that what he's doing is making sense. So I guess my main point is that we have an opportunity right now as data professionals to get in there and call for these standards to be aware, to be more broadly made aware. Oh God, wording, I'm not. But I hope you're getting my point. I think we have an opportunity right now, and ideally, I'm not the one to say it to the world. Maybe we need to do an IASSIST project that has COVID-specific activity. And actually, this bleeds over into the the riots for George Floyd. And I think that we can do a lot of good to help people say that, you know, having accurate data is power. And we need to have the upper hand on creating reliable access to reliable data so that there is a source of what will amount to truth as the information wars continue.
Those are great points. Bob Ray also is raising his hand. I'm going to unmute you, Bob Ray.
I thought my hand was down, actually.
Oh, really?
Sorry.
Well, I mean, I was about to say that's it was a brilliant number of points you've made there, Paula. It reminds me of a couple of things. One is as this crisis was beginning, one of the analysts in my team, actually wrote a blog about the problems of data sharing and encouraging researchers to share the data that they've been using for their analyses. And the blog went on to talk about some of the issues around metadata, sharing syntax, sharing the data, why this wasn't happening. And it really kind of struck me because I kind of thought, and I'm sure a lot of people on here would sort of recognize, you know, almost sort of felt we've been talking about this for years. And I wonder, how's the best way to get traction? Because like, I completely agree with you, Paula, like you know, this is a important time to be raising these points. I suppose my question back to you, Paula, is, in my mind, why is it that the analytical community can sort of shout louder than the data professional community can? And that's definitely not a criticism of our community, but to me, that's how it seems to roll.
Well, I have bad attitudes about classism in higher ed, but I do believe that when we bring it up directly with the researcher, the situation is, you're getting in my way. I've got this work to do. I've got to get this article out. Stop getting in my way. And so to me, the avenue for the greatest growth is going to be among the people who are not in academia specifically. And that's the data scientists out in the world who are, and the data activists, or the data scientists who would become activists, right? That by chance, or because the tools are finally accessible to them. The places that I think that we could be developing greater awareness would be in the Git community, in those more public, less like non-structured environments. It's gonna, I think, require infiltration really into data carpentries, into software carpentries, into those communities in which people are unaware of the work we've been doing forever, and are hungry for this information. There's a DataKind is a data organization. A speaker or the originator of DataKind, which is a social science, social service, public service data science group. I don't even know how to describe it really. But the leader of that came and talked to Carlton, I don't know, about 4 or 5 years ago. And he had absolutely no idea that there was a foundation on which he could be standing. And he disappeared after he left the campus, and I never talked to him again. But it's people like that who now are like, oh my God, when you say year, what do you mean by that? Because it turns out our graphs don't make sense. And that's that's where we have action. I think we can really make some movement in that world. I personally don't know how to do that exactly, but I have an intuition that that's where we need to go.
And I think Paula, what I'd like to take away as an action points, and I'd certainly be happy to work in this field if others would like to join me, is to work with IASSIST and others to put a manifesto together to think about how this can be tackled, and to do something quite urgently. And I think, because I think we have quite a small window of opportunity, I think, for getting that message out. I do think that things will start to go back to normal. So we have maybe a few months to sort of highlight these issues.
Yeah, normal is a danger to us.
I think another sort of question we've got on the slide is about how data infrastructure and data sharing infrastructure has changed. Sorry, my keep going back to my desktop there. Yeah, another question we had was about how data sharing infrastructure has changed. And I'm going to ask Debbie to say something, but before I do, I did actually just want to congratulate ICPR on. I noticed that they actually have now launched a couple of weeks ago. I think they launched a COVID-19 sort of data repository. I don't know if there's anyone from ICPSR that would like to talk about that, but I got the impression that got built and made available in a matter of weeks. And when I saw the website, I thought, oh my God, I can't believe they've done this so quickly. And what have we got in the UK that's similar to that? So if there's someone from ICPSR that would like to talk about that briefly before handing over to Debbie, that would be awesome.
Unmuted.
If not, Debbie, do you want to talk about? You had a prearranged question about data sharing infrastructure. I think that you were going to mention.
Yeah, it's kind of tied into some of the things we've been talking around already. And what I'm really interested in is the speed of change. So part of my role is to work with researchers who are accessing legally controlled data, so secure data. Now, this has been a conversation which has sort of rumbled in the background for the entire time I've been at the archive. We've had researchers say, why can't I access data from home? Why do I have to go into my office and sit at a specific PC all the time to do this? It's not very flexible. And of course, with the current situation where the majority of people can't now access their institutions and their specified PCs, it's data owners have now changed, made some temporary changes so that researchers can apply to work from home. There are obviously very strict conditions that they have to accept and meet. So it's certainly not a free-for-all, but it is quite a significant change, although it's temporary. And I'm just curious to see, as we hopefully start to come out of this current situation, what the impact of those temporary changes are going to be. I don't know how people will adjust to going back to normal, for want of a better word. I don't know sort of whether people from other countries have had similar changes. Is this quite a unique thing that's happening in the UK?
So
sorry, we had a few questions. So we have Camille. I'm going to unmute you.
Hello, can everyone hear me?
Yes.
Great. So I think I misunderstood a bit what this webinar will be about. I'm from a longitudinal study, and I thought this would be more of a practical guide. But in particular, we have genetic data on our participants, and we have lifetime histories, and we have an interest of linking our participants to COVID-19 outcomes, as is will only get mortality, right? If somebody died of COVID, we'll get that through NDI, but it feels like there are all these longitudinal studies out there, and I was wondering if there's any initiative to allow these studies to connect to COVID diagnosis.
So I think it will probably depend on the longitudinal study. I do know that in the UK we have a really good longitudinal study called Understanding Society. That's already been linked to, it's already had some fairly basic biomedical data collected for the participants for a few years ago now. It has been linked to some of our hospital records data, and I think recently there's been an update where people have been asked about their experiences of living with COVID-19, and I think particularly during the lockdown time. And so I think that's probably quite a good example of a longitudinal study that has reacted quite quickly to the current situation. Be really interested to hear from anyone else if they know of any other longitudinal studies that have done the same.
I'm not sure what the birth cohort studies are doing, Richard.
No.
I don't know if you perhaps know more. I know they are collecting COVID-related data, but I'm not familiar with what linkage will be available with health data for those.
Well, I mean, I think the very fact that they are collecting COVID data is quite an achievement, because I think for a lot of these studies, you know, there's in terms of putting new questions in, the resources that go into that, the validation that has to happen, you know, it's quite resource intensive. So I think if after a matter of, you know, 2 or 3 months, even weeks, that kind of those kind of efforts are going on, I think that's really encouraging.
Okay, so no initiative in the US so far as you know.
I'm not sure if anyone can hear me. Hello?
We can? Mm-hmm.
Yes, we can hear you.
I am aware of quite a few studies in the UK. So there's some studies, there's at least one study in Bristol, the ALSPAC mums and dads. They've actually, they are linking together with genetic data, family-based genetic data as well. And they've actually sent out surveys to all the participants as well to collect general information. And they are linking through hospital records and linking to COVID swab test as well. And there are a few studies within UCL as well, a few consortia in UCL who have also genetic data and are planning on using similar questionnaires to collect data on COVID-related data and link into COVID tests. And I think I heard that the UK Biobank is also planning to do the same. So that's a huge study of 500,000 plus with genetic data and linking to COVID tests. So there is quite a few studies doing exactly that in the UK that I'm aware of.
Okay, well, we are a US-based study, and yeah, if we knew that some US longitudinal study did it, we could ask them how they've done it and perhaps do it with our data. But I guess we're a very small operation; like we don't have the know-how to tackle a task like that without someone clearing the path. Okay, thank you.
Thanks so much. And if there's anyone from the US that knows of any longitudinal studies which are adapting to COVID, you might be able to ask a put something in the chat so that the gentleman has something to refer to. Thank you. So I think one of the we have about 6 or 7 minutes left, and I think one of the things I'd like to talk about are whether some of the changes we've seen for data access and data infrastructure, whether these things will be permanent. And I'd like to give an example of a situation I was in quite recently, where I was asked to acquire some data from intensive care units in the UK quite quickly. We had a couple of weeks to do this, so that we could, so my team could get out some rapid analysis. And we used a new service which was provided by an outfit called NHSX, and we basically just sent them a 2-page form explaining what data we would like and what we wanted to do with the data. It was a very simple 2-page form. We sent it to this new NHSX COVID data sharing service. Within 3 or 4 days, we'd heard back from them, and they identified the organisation that could supply us with the data. And they sent the form on to that organisation. And 3 or 4 days after that, we had an approval, and this was all sorted out in about 2 weeks, which was really quite astounding, I think, since we've been used to acquiring data usually in timeframes of 9 months to a year, and I know a lot of researchers wait even longer than that. And that's a really good change. I don't know if that will be a permanent feature of data access going forward. And going back to the what Debbie was saying about allowing researchers to use sensitive data from home, can we assume that's going to be a permanent change as well? And I know, I'm glad, Simon, you're on the call, because I know at Cancer Research UK you do allow researchers to access sensitive data from home. My organisation allowed that to happen very quickly in response to COVID, and that's probably going to be permanent. But if anyone has any thoughts about that, and whether these changes that we're seeing will be permanent, that'd be really interesting to hear.
Yes, yeah, we are. Sorry, just to jump in, we do have. We've always allowed kind of people to access the sensitive data from home. Really, 2 principles behind that. One is in terms of equality legislation. So for us, when we're thinking about why someone might be working from home as opposed to coming to the office, it could be because of health reasons, it could be because they have caring responsibilities, and we didn't feel that it was reasonable to say deny them the opportunities to work with the sensitive data and do these kind of more in-depth analyses on those basis. So that was one of the justifications for why we allow it. And I think the other one as well is that people might say, well, doesn't that open up a certain amount of risk? And my response is always, if I didn't trust them to act in the right way, I wouldn't let them have access to the data in the first place. And so it does seem somewhat odd to be, on the one hand, saying we trust you to access this data, but not that much, because we want you to do it in a really in this particular environment that we've dictated almost, which isn't quite trusting them, I don't think. But you know, appreciate the fact that we have a relatively small team, and we're better able to manage that risk, whereas larger organizations it might not be so easy to do. But yes, that was just why we do it, and we will be continuing to do it after COVID.
I think risk is a very hard concept, isn't it, for a lot of data owners to grapple with. Certainly, you know, I spent a bit of time last year visiting teams who collect clinical data, and that's a recurring theme that comes up. They're not confident enough quite often to determine what the level of risk is. And certainly a lot of people become very attached to this idea of zero risk. And I don't know that such a thing is really achievable in reality, but I think it's a concept that a lot of people, especially when dealing with very sensitive data, such as health data, I think people are quite cautious by nature.
Okay, I think that's true. For a long time, risk has determined the level of sharing of data, but recently, just leading up to COVID-19, and I think COVID-19 pandemic has really highlighted this fact. That I've seen a few surveys commissioned by a few mainly patient and participant focus groups, where they've asked people whether they're happy for their data to be shared for different purposes. And overwhelmingly, people have said, yes, please use my data for this and that purpose. So I think COVID-19 has really highlighted how dependent managing this pandemic is on good and accurate data availability, and people are aware of that, and people really do want their data to be used. So that is shifting the fear of risk a little bit away from data controllers, and controllers are more willing to contribute their data to data linkage initiatives and using the data in research, provided the legal basis is secure.
Thank you. Thank you so much, Jørgen. Is there any views from outside of the UK on the data sharing infrastructure? Anybody that would like to come in? If not, we've got a couple of minutes left. So I think what I'd like to do is hand over to Sarah, because Sarah, I think you've been just sort of capturing some notes and some actions. Would you like to provide a summary, please, before we finish off for the day?
Yeah, I'd be happy to. So I think this has been a great discussion. It's been a little challenging with the technology. Thanks for bearing with us. We've been figuring out how to use this platform for discussion, but there's been some great comments, and I've taken notes, which we're happy to share. So thinking about addressing, the challenges, we talked a little bit about challenges of the lack of peer review, and for research and data, and what that means for our roles as data professionals, data curators. Talked about how do we just encourage standardization across both regional, national, and international sectors. Also, I love the comment about the fact that this is a real opportunity for us to engage with data activists and data scientist communities. And I love Richard's idea about thinking about some sort of manifesto or commentary that we can put out there, since this is kind of a timely opportunity. And then some of the thoughts on both positive and negative long-term implications of this crisis for our profession. So I think these are all really great ideas and thoughts that we can sort of put toward thinking about how IASSIST, but also how the data, health data interest group can maybe start addressing some of these challenges and helping our community to sort of take advantage of, but also get through some of these challenges that we're facing now. So we're very interested in hearing from all of you in terms of how you think this group could help, and really appreciate your time and participating.
Thank you, and I think we'll end there, and yeah, we'll share the notes with everybody in due course. But I really want to thank you, thank everybody who's attended this afternoon or this morning, depending on where you are, and for raising questions and raising some really interesting points, and for providing us with some material to go away and action. So thank you very much. We'll be in touch again soon. Thank you, and have a good day.
Thank you. Bye all.